All right, let's get some insight now into the impact of the Pfizer vaccination rollout. Discovery Health is tracking the data on its members who've been vaccinated. It seems that even with just one shot of the two-dose jab, within 15 days there is a significant reduction in COVID risk. And to tell us more, I'm joined by the CEO of Discovery Health, Dr. Ryan Noach. Dr. Noach, thank you so much for your time. So just tell us about this data. How many of your clients have received Pfizer, and what is the early data telling you?
Evening, Sally. Thanks for having me. We've got about 110,000 of the medical scheme members that we administer at Discovery Health who have received their first dose of the two-dose regime of the Pfizer-BioNTech vaccine. We're seeing already very promising data in the cohorts after the first 15 days, and particularly after 21 days post-vaccination. What we're seeing in that group on an age-adjusted comparison, in other words, comparing them to an unvaccinated group of a similar age group, we're seeing 34% lower new infections. In other words, the incidence of infections is 34% lower. Much more importantly, we're seeing almost a 50% lower admission rate to hospital. And so, the vaccine's primary purpose is to prevent severe disease, and we're seeing that being materialized after just this first dose, 21 days in. And then thirdly, and quite importantly, we've had no deaths at all yet in the group that are 21 days plus post-vaccination, relative to all other cohorts, the unvaccinated cohorts or those who've just had the vaccine, in which there are unfortunately and tragically multiple deaths. So on all levels, infections, admissions to hospital and mortality, this very early data, and it's only 6 weeks in, so it's early data, is very promising.
Absolutely, and I mean, it suggests that after the second dose, they're going to be really well protected. So it's a little bit of a glimmer of hope in this really tough situation we're facing, particularly here in Gauteng. I spoke to the MEC for Education in Gauteng, Panyaza Lesufi, a little earlier. They've released about 46 vaccination sites for the teachers. Some of them are sites that are already up and running. Others are specifically for teachers. But I did notice that Discovery Health site is there. So I need to ask, have you received the Johnson & Johnson jabs for the teachers at that site? What's the latest?
We're delighted to be supporting the Department of Education and the Department of Health. The moment we heard about this brilliant initiative of this additional stock for teachers, we extended an offer to be involved. We are only now in communication with the Department of Health. This is unfolding very quickly. Our site is up and running and ready to administer vaccinations. We haven't received the specific Johnson & Johnson stock yet. We are in a position to receive it and to administer it. The vaccinators are trained. We do have adequate Pfizer stock, and so we are ready and willing to help as required.
That is really wonderful news. I also have to ask you about more stock coming. We know there was that massive disappointment with the doses that had to be destroyed from Johnson & Johnson from the Aspen factory in Gqeberha through no fault of their own, but of course something that happened in the USA. We know they ramped up production quickly, and there should be 1 million or 2 million doses being released from the Aspen factory in the Eastern Cape. To your knowledge, have those doses been released? How soon are they going to start flooding to vaccination sites such as yours?
To the best of my knowledge, they haven't been released yet, but it's quite possible that I'm out of the loop on that, since Aspen releases these J&J doses in terms of the procurement contract directly to the Department of Health, who has purchased all vaccines for the country centrally. I'm quite excited by the prospects of these stocks that are now coming in large numbers. I'm hoping that we're through the period of supply constraint, and it looks very much, if all the promises are met now, like we'll have more than enough stock. This moves the onus to the vaccination centres, to both the public and the private healthcare sectors, to increase the number of vaccinations they're delivering to keep up with this increased stock flow and make sure we really are getting as many needles into arms as possible.
We also know that Phase 2B is going to start quite soon. I don't think we've been given clear dates. That will mean that people who work in congregate settings, those with comorbidities and essential workers will also be in line. Do you have any idea of the timeline on when that's going to open up, or is it dependent on availability?
I do not have a confirmed timeline, but I can tell you that much like what you're saying, we're strongly of the view that it's going to happen much sooner than anticipated. From what we're seeing at the sites and in the site numbers, we are ready, I think, for the next tranche of people to be prioritized. The decision around prioritization will be taken by the Department of Health on the advice from the Ministerial Advisory Committee for Vaccines. And it seems very likely to us that it will be another age-based decision, that there'll likely be an age cutoff, together with, as you say, the occupational program that was described by the Department of Health recently and some of the congregate setting groups. So we're ready and waiting for that. The high-velocity nature of this campaign is absolutely essential, particularly in the context of the third wave that we're in at the moment.
Yeah, and particularly here in Gauteng, where the Premier has told us it's dangerous to be in Gauteng right now. It's been described as a catastrophe by Professor Glenda Gray of the Medical Research Council. You, of course, as a medical scheme owner, must be very concerned about your patients. But also, what are your opinions and thoughts about the way forward as we try and get through to the peak of the pandemic and beyond?
The disease is highly unpredictable, and we really don't know where the peak is. And, while I agree it's dangerous to be in Gauteng, quoting yourself and I think it was the MEC who said it, or the Premier,
yeah.
Actually it's not dangerous if you stay home, socially distanced, remain in a small family bubble, do not interact socially, order your stuff online if you need to order food and other goods, wear a mask at all times, and remain outdoors in well-ventilated areas if you do have to leave the house. The control of this is in our hands. It is human behavior that leads to person-to-person transmission, and we really do need to take complete ownership of that at the moment.
How concerned are you for your clients who might be trying to find a hospital bed this evening?
Deeply concerned. The epidemic at the moment, this third wave in Gauteng, has exceeded 30% of the highest point, 30% higher than the highest peak we've seen in Gauteng ever since the start of the pandemic. So it is a significantly worse wave in Gauteng than we've ever experienced. As we sit here today, many of the hospitals in Gauteng are already complaining of inadequate capacity, full ICUs and stretched ventilator resources. But what we see in the data very clearly is that hospital admissions follow about 2 weeks after the infections are recorded. And so with us recording such high infection levels every day at the moment, we still need capacity to reach those peaks at least 2 weeks from now and probably further on. This is extremely worrying. I should say that to date, throughout the COVID-19 pandemic, we're delighted that we've worked hard to ensure every member receives access to a hospital bed when they need it. And working closely with the hospital groups and partners, we're making sure that we make every effort to ensure that going forward.
All right. Well, thank you so much for your time this evening. That was the CEO of Discovery Health, Dr. Ryan Noach.